You've probably heard the phrase leaky gut from wellness influencers or supplement companies or on social media, but what does it actually mean? And is it something that doctors take seriously? Welcome to another episode of Hey Doc, Quick Question. I'm Dr. Jeremy Alland, board certified sports medicine doctor and team physician for the Chicago Bulls. This podcast is dedicated to answering the real questions you're asking on a daily basis. And so we have another great question from a listener. Let's get to it now.
Hi, my name is Jenny, and I am calling because I'm wondering about leaky gut. And is it a real thing? Is it actually something that I should be taking medical steps like testing? I'm not sure. There's so much information out there. It's hard to know what's actually true and what's not. Thank you. Bye.
This is an awesome question and one that I see all over my social media feed. But if I'm being honest, I don't even completely know what leaky gut means. I reached out to friend and board certified gastroenterologist at Oshi Health, Dr. Treta Barot. Dr. Barot and I are going to break down leaky gut so that you understand what it is right after this break. So we're going to dive right in with our listener's question and answer directly, is leaky gut a real thing? It turns out it is. And after my discussion with Dr. Barot, what I learned was that it's not actually a medical diagnosis, but it is an actual condition. What do we mean by that?
So we're talking about the leakiness of the gut barrier. And I think it's important for us to understand what is this gut barrier. So we should think of it like a security system for our body, right? It decides what gets in and out, and it's the longest security system between what you eat and what goes into your bloodstream.
See, your gut barrier is supposed to be selective. It brings nutrients and things that we need in while keeping harmful things out. And when we have leaky gut, what that means is that the barrier is not doing a good job of keeping the harmful things out. So my misconception of this was that I thought leaky gut would be leaking out of me, but in reality, it's leaking into us that is the problem. When the barrier is disrupted, that is what's called increased intestinal permeability. And that actually is truly what's going on here. It just doesn't have the ring of leaky gut. Kind of reminds me how Chilean sea bass is the new name for Patagonian toothfish because nobody wanted to order the Patagonian toothfish. Leaky gut sounds better on social media. Increased intestinal permeability just doesn't get the traction. But that doesn't make it any less real.
It's not a medical diagnosis, right? Because it's a condition, it's a physiologic condition where your gut permeability is changing. But what it can present is a wide variety of symptoms. So if we just talk about the GI tract, it can be bloating, abdominal pain, change in bowel habits.
So in this way, leaky gut is actually more of a process than a true condition, and therefore it's not permanent. That's the interesting thing about leaky gut. It's dynamic. It can be breaking down at one moment, and the next moment it can heal. We do know that there are certain exposures or risk factors for leaky gut.
What are the factors that can increase intestinal permeability, which means lead to leaky gut, and what are the factors that we can do to prevent it? So there's studies that show that heavy alcohol use causes leaky gut. So it affects your epithelial layer and causes damage. We know intake of ultra-processed foods and emulsifiers can damage the lining of your gut. Chronic stress, and I think that comes from the gut-brain axis and the neuromodulator release. Heavy use of antibiotics because then it affects your microbiome. And then one part of leaky gut, a specific subset, is inflammatory conditions of the gut, like Crohn's and ulcerative colitis and celiac, where just the underlying inherent inflammation from autoimmune disorders is causing leakiness in the gut.
But the fixes, they're actually surprisingly simple compared to what you may hear.
We can talk about the things that enhance the gut barrier, right? Cutting down alcohol consumption. If you decrease your intake of processed foods, and you do want to spend some time on fiber. We all think fiber is a bulking agent, helps with good bowel movements, but also fiber plays a very important role in gut integrity. When fiber is broken down by the microorganisms, it produces short-chain fatty acids, which are very important for this gut wall. So if you increase your fiber intake, we know supplementation with vitamin D, having a wholesome diet full of grains and nuts and vegetables can help maintain gut integrity. So when there were studies and they made these changes in individuals and they measured intestinal permeability, there was improvement in the gut barrier. So yes, you can definitely change it, improve it, for sure.
The things that actually work are changing your diet, improving your stress management, and getting back to the basics of an overall healthy lifestyle. So how do we know if at any given moment we have this condition? Well, this is where it gets challenging because there really is no specific test for leaky gut. When you look at studies that are done in journals in big academic institutions, they're using very, very sophisticated testing methods to actually test intestinal permeability. And you can do this, but it's not accessible for the average person or average doctor, and it certainly isn't at your wellness clinic or your functional medicine doctor. There's just really no way to know if you have leaky gut at any given moment. So the only thing we can do is follow your symptoms. So if you're somebody that's experiencing bloating or abdominal discomfort or constant nausea or maybe irritable bowel type symptoms, leaky gut can be a part of this. So here's my take. Leaky gut is clearly a real thing, but it's a condition, not a diagnosis. And therefore, the most important thing to do is to establish with your doctor first to make sure you don't have one of these other medical diseases that can be associated with leaky gut. You don't want to have celiac disease or Crohn's disease or inflammatory bowel disease and find out that you were treating it with supplements rather than proven treatments that would prevent them from getting worse. Your leaky gut would improve if you were treating the underlying cause. And for those of you who don't have an underlying cause, and that is all too common, where patients will have these abdominal symptoms that have all normal testing and nobody knows what to do with them, and they can feel dismissed by their doctor, and it leads to a lot of desperation and hope. To those people, I would never dismiss you for having leaky gut symptoms. These are real symptoms. But the answer isn't going to come in $300 bottles of supplements. It's not going to come from certain courses with wellness doctors. It's not going to come from a panel of 900 tests from a functional medicine doctor. The answer comes down to looking at your habits, making sure that you're not doing any of the risk factors, and meeting with board-certified gastroenterologists or primary care doctors who take your concerns seriously. That's where Dr. Barrowit and Oshie really come in. They focus on giving people full 45-minute to an hour sessions with their nutritionists and their doctors and making sure that they feel heard for symptoms that they probably have not been able to find answers for. So to our listener, thank you so much for this question. Leaky gut is a real thing, but many of the things that are being sold to you on social media and over podcasts just aren't the answer. If you feel like you've been dismissed by your physician or you're not getting the answers you need, please don't stray to these things that are preying on your hope and desperation, but rather I'd hope you continue your search for a doctor who will take you seriously and will listen to your concerns and make sure that you feel heard. If you're listening to this episode and you feel like you fit into this category, I highly encourage you to consider Oshie Health. I do not work with them, and nor do I have any financial obligation. I know that they will give you the time that you deserve, and they will use all of their resources to try to find you an answer. And if they can't find you an answer, also help you with your symptoms. They're in all 50 states and accept most insurance plans. This was an awesome question, one that I had many questions about, and I really enjoyed having Dr. Barrowit on. Thank you again, Dr. Barrowit, for coming on and answering our questions. I look forward to answering your question next week. Go to hey.quickquestion.com, click the button and submit your question so that you can be on the next episode. And it would mean a ton to me if you were willing to subscribe and share this with any friends and family or on social media. Thank you as always for allowing me to be a part of your podcast routine. I'll see you next week. Hey, you made it to the end. Great. Now the legal stuff. This podcast is for educational purposes only. It's not medical advice, and listening doesn't make me your doctor. I mean, I like you, but we don't have that kind of relationship. So please, don't use this podcast to diagnose yourself or to treat other people. Always talk to your actual doctor or healthcare provider when it comes to your health. Neither I, Dr. Jeremy Alland, any guests, nor Hey Doc Quick Question LLC can be held liable for anything you do or don't do based on what you heard here. In short, this is information, not a prescription. Be smart, stay curious, and talk to your doc. Oh, and hey, send me your questions.